Today we are here to briefly talk about the early warning signs and early detection of cancers of the large intestine, that is the colon and the rectum.
A very good day to all of you. I am Dr. Deepak Govil from the Department of Surgical Gastroenterology and GI Oncology at the Indraprastha Apollo Hospitals, New Delhi.
And I am Dr. Vivek Tandon, also from the same Department of GI Surgery and GI Oncology at Indraprastha Apollo Hospitals. Dr. Govil, we have been seeing an increasing number of patients with cancers of the colon in our country. What are the early signs and symptoms that you would advise a patient not to ignore so that the disease can be picked up early?
Yeah, thank you, Vivek. I think it is very important to identify these patients early. So we have to be very careful about the signs. And if any patient feels that there is a change in bowel habits, like he's never got constipated and he gets constipated, or after being constipated for a while gets loose motions. So if there's a change in the bowel habits which has occurred over the last few months, then you should be careful and get yourself examined, and there can be a suspicion of malignancy of the colon. The other important sign is if there's blood in stools. I think this is a very important sign which should not be ignored. We usually have a tendency to ignore these things, and majority of patients, female patients, sometimes are very shy of coming out of these complaints. So I think that is an important thing. If you have blood in stools, never ignore it. Get yourself examined. It may be piles, but a lot of patients we see come as piles and are coming out have a malignancy. Then if the patient has a general fatigue, if there's a general weight loss and generalized weakness without any reason, if you're eating the same meals and there is a change and you feel that there's a weight loss in spite of everything and generalized fatigue, then you should consider that you should show to a physician and get yourself examined. And significant weight loss definitely is important to identify these patients. So it's really important to identify these cases early.
So Dr. Govil, if a person like this presents with these kind of signs and symptoms to the outpatient, what are the tests that one would advise to pick up these patients and diagnose them early?
Tests are very simple. Actually, for these patients, routinely we get a colonoscopic. Firstly, a physician sees the patient. When a physician sees, he does a rectal examination so that if there's any local tumor, they can be identified, or piles, they can be identified just by a local examination by a physician. Otherwise, you can go ahead with other examination where we use an endoscope to do a sigmoidoscopy or a colonoscopy. And also in patients who are at high risk of malignancy, like patients who have a very significant family history of cancer, in those patients we can just do a stool occult blood. That is an indicator that if that is positive, because a lot of times, sometimes you see blood coming out in stools, that's very clear. But sometimes there's microscopic blood which keeps flowing and the patient becomes anemic without realizing that his hemoglobin is 6 or 7, and then they present to us. So I think it's important to identify these patients early.
We hear a lot about screening programs, especially in the West. Are there any reasonable screening programs which can be done to pick up these patients early?
Actually, the screening programs for a general public are not economically viable in our country because the incidence is not as common as in the West, although it is rising today and we are seeing more and more young patients with colorectal cancer. But the important thing is we have to identify high-risk groups, and these high-risk groups are like patients who have had a family history, and patients who are anemic, patients who have had ulcerative colitis, or patients who have had polyps in the colon. Those are the patients who are at high risk of developing colorectal cancer. So these patients we should not ignore, and we should have a regular screening for these patients. Regular screening can include stool occult blood, which can be done at least every 6 monthly or a year after the age of 40 years. Every year at least once these tests should be done. And if there is a suspicion of a positive stool occult blood test, which is a very simple test, if it is positive, then we can go ahead with other tests like colonoscopy or sigmoidoscopy.
Thank you very much, Dr. Govil. So just to summarize, we have talked about the early detection and diagnosis of cancer of the colon and the rectum. And to summarize for our viewers, the warning signs that must be looked for are a change in bowel habit, sudden loss of weight, sudden fatigue, bleeding from the rectum. Also, once a patient like this comes to the OPD, the tests to diagnose these cancers are simple and easy to do. Simple local examination can help pick up some patients. Others can be diagnosed on stool or cut blood, as well as colonoscopy, which also today is a OPD procedure. Early diagnosis allows for a timely treatment of these patients. Thank you.